Hello, good evening, everyone. Hi, welcome to our Facebook Live this Thursday again. And it's been a while that I haven't seen you guys. I'm really very sorry, but here I am. So, but anyway, for tonight, we're gonna have your Facebook Live again. Okay. Um, I would like to introduce myself. Okay, so my name is Mr. Alan Matus, and I am a nurse educator. I have been teaching nurses for almost 25 years, and also I'm the author of the book, which is the Simple, Fast, and Easy NCLEX Review that you can find in Amazon. Okay, so here you go. All right, so that is my book. So you can buy that on the website, and also it's available now in the Philippines. You can email matusnursingreviewacademy@gmail.com to purchase the book, everyone. And of course, it has a 5-star rating, and a lot of students like the book. So if you want to have the book, everyone, you can go to the website. All right. All right. But anyway, I'm also currently a nursing faculty in a school, and I help students pass their licensure examination. Okay. And of course, as what I have said, I help students pass their NCLEX exam. So for tonight, the focus again, like what we discussed before, are questions on prioritization and delegation. And I mentioned earlier what's going to be the topic for tonight, and as it starts with letter P. So P means that would be your psychiatric nursing. Okay, psychiatric nursing. So I'm not really very sure if you're very good with psychiatric nursing, but we will find out tonight definitely. Okay, so we have prepared very nice questions for you to test your critical thinking for these types of questions. But anyway, before anything else, I would like to give a shout out to some of our early attendees for tonight. Okay, so for tonight, we have Gian Torres, who was one of the earliest persons to come over. We also have Kadiato Trawali. Okay, it's been a while. Okay, I know that you miss me, guys. Okay, also we have Alfred, Amaka, Nimko, Ayadi, Abidemi. Um, Also, we have Lani, Yan Yan, and also thank you very much also for the nice messages that you're putting in the comment section, everyone. I really appreciate that as well. Okay. Uh, all right. Okay, so we have, well, I have just been so busy lately. Okay, so that's the reason why we were not able to do the Facebook Live. And I got my second dose of vaccination for COVID. And I think all along they have been telling me that the second dose, usually you will have a little bit of a reaction, like a little bit of feverish, reaction. And I think it was true because the next day I developed like a little bit of muscle pains and then also fatigue. I just want to sleep. And at the same time, a little bit of a low grade fever. But then after that, it disappeared. So I think my immune system was reacting to the vaccine. Okay. So, but anyway, we're back here tonight, everybody. So I'm so happy to see you. So before anything else, I would like to announce that for Saturday, this coming Saturday, finally, we are starting again the next batch of our 10-day. Okay, for our 10-day live comprehensive NCLEX review webinar. So it's an interactive online NCLEX review to master your nursing content. So the focus of this 10-day live comprehensive NCLEX review webinar is going to be about content review, especially for students who graduated like 10 years ago, 15 years ago, or maybe you're a new graduate and you feel like you want to master your content, especially before you answer your practice questions. I always tell students that before you can do your Q banks, you need to have a very good nursing foundation. You really have to know your content. Okay, so this is the review program for you guys. And the review program, of course, comes with a workbook. So it's every Saturday. That will be from 8 to 4 p.m. That would be every Saturday for 10 days. So until June 26, 2021. So I am so excited to meet our new students this Saturday, definitely. Okay. All right. So another one also, just a quick announcement before anything else. We have an upcoming sale. Okay. That will be Cinco de Mayo sale upcoming in May. So that will be 50% off again for our self-study program. So if you're doing the self-study, that will be 50% off, 1 year unlimited online access review, and then also that comes with a 30% off for our workbook. So the workbook also is 30% off. So wait for that, everyone. That's going to be May 1 to 5, 2021. We're going to put the code in the website. okay, so that you will be able to use the coupon code and then of course purchase 50% off, okay, which is a good deal definitely. All right, another one, of course, for tonight, everybody wants this, okay? So I think everybody has been waiting for this, the free 90-day online access NCLEX review. So make comments, everybody, and then we'll put your name in the software and the system, and then we will announce the winner immediately after this Facebook Live, okay? All right. Okay, so now let's have another one. Okay, just a little bit of request. So are you ready for our first question for tonight, everyone? That's going to be my question for everybody. Are you excited? So we have challenges for tonight, but hopefully that you will enjoy our first question. So are you ready? Our topic for tonight, as what I have said, is going to be about psychiatric nursing or mental health nursing. And of course, for those taking the NCLEX-RN, there will definitely be questions about psych. The same thing with NCLEX-PN, everybody. Okay? So our first question for tonight, everyone, is all about prioritization for psychiatric nursing. Okay? All right. So the question, I will read everybody. The nurse is caring for 4 clients in the psychiatric unit. Which client needs priority intervention? A, the 45-year-old client who experiences dry mouth and nausea after taking imipramine. B, the 26-year-old client who reports decreased libido and weight gain while on paroxetine. C, the 54-year-old client who complains of feeling drowsy and sleepy after taking diazepam. Or letter D, the 65-year-old client who develops rapid eye blinking and lip smacking while on haloperidol. So can you please put your rationale for picking your answer, everybody? Okay, so I will read the question again. So the nurse is caring for 4 clients in the psychiatric unit. Which client needs priority intervention? A, the 45-year-old client who experiences dry mouth and nausea after taking imipramine. B, the 26-year-old client who reports decreased libido and weight gain while on paroxetine. Letter C, the 54-year-old client who complains of feeling drowsy and sleepy after taking diazepam. Or letter D, the 65-year-old client who develops rapid eye blinking and lip smacking while on haloperidol. So who do you think will be the priority in this question? Okay, now some of you are putting rationals. I haven't seen a correct rationale yet, so keep on trying. I'm trying to look for the right word, okay, for your answer, everyone. Why do you think is A, B, or C, or D the correct answer in this question? So this is psychiatric nursing prioritization. Okay, all right, so what do you think is the answer? So we have a couple of people putting their answers right now, so let me see. All right, so let's have the correct answer to this question. Okay, all right, so what will be the correct answer? Okay, so let's have the answers, everyone. So that would be your letter. Very good. So that would be your letter D, everybody. Okay, now why is letter D the answer to this question? Because number one, your letter D are signs and symptoms of tardive dyskinesia. Okay, so tardive dyskinesia is an adverse reaction when a patient is taking antipsychotics, and for example, that would be your haloperidol, or the brand name is Haldol. So remember your different types of antipsychotics because they block dopamine, and when you have a reduced level of dopamine, they can cause the person to experience Parkinsonian-like symptoms, and at the same time, extrapyramidal symptoms like dystonia, akathisia, for example. Okay. However, your rapid eye blinking, lip smacking, tongue protrusion, okay, or puckering of the mouth, for example, those are signs of tardive dyskinesia, which indicate a severe adverse reaction. So it must be reported to the physician immediately so that we can reduce the dose or stop giving the medication. Okay, so it's very important in order to make sure that we treat this adverse reaction immediately. Okay, so This is a common focus in psychiatric nursing, especially when you're taking when you're giving antipsychotic medications, which are highly regulated medications, not only in long-term care but also in hospitals. Your tardive dyskinesia usually happens when your patient takes the medication for a long time, and you have a lot of antipsychotic medications. Okay, you have your chlorpromazine, thorazine, you have your trifluoperazine, stelazine, you have your quetiapine, Seroquel, for example. So memorize all of those antipsychotic medications and their common side effects, especially the extrapyramidal symptoms because of the reduced level of dopamine. Okay, your letter A, dry mouth and nausea, especially your dry mouth, is a common side effect of tricyclic antidepressants or TCAs, which is your imipramine, tofranil. Okay, so anticholinergic drugs or anticholinergic side effects include dry mouth, constipation, and urinary retention. Now, I would like to let you all know that when you're studying psychiatric medications, you need to be aware which drugs cause anticholinergic side effects because they are usually being asked in the NCLEX. So which classification of those drugs, your antipsychotics, your TCAs, they cause your anticholinergic side effects. So be aware of that, everybody, okay? Now, letter B, decreased libido and weight gain are common side effects of your paroxetine or your selective serotonin reuptake inhibitors. So you have your paroxetine, a common brand name for that is your Paxil, for example, okay? Your letter C, taking your benzodiazepine. So you have your diazepam, common brand name for that is the Valium. Feeling drowsy and sleepy is a common side effect also of the medication. But of course, when these side effects happen, we need to make sure that we also take precautions like fall prevention. Okay, so remember that, everyone. So D is the priority in this question. So hopefully you like the rational. Definitely A, B, and C are side effects, but of course we have to address them. But D comes first because that is something that we need to report immediately, everybody. Okay, so study your psych drugs. Okay, and we'll put more information in the comment section later on, the side effects of your antipsychotic medications. And remember, you have 4 main classifications of psychiatric medications. You have your antidepressants, and it has 3 main types. Okay, you have your selective serotonin reuptake inhibitors or SSRI, you have your TCA or tricyclic antidepressants, and then also you have your MAOI or your monoamine oxidase inhibitors. Okay, these 3 main antidepressants. Then you have your anxiolytics or anti-anxiety medications. Then you also have your anti-manic medications. And lastly, you have your antipsychotic medications. And I would advise you to make flashcards or put all of these medications in the walls of your room as you are studying because psych drugs definitely will be in your NCLEX. And don't focus too much on the brand names because in the NCLEX, you will always have generic names. So be more familiar with that, okay? All right, so we have the next question, everybody. So congratulations for those who gave us the correct answers and rationals. So Alfred said lip smacking, cheek puffing, blinking of the eyes, tongue twitching are signs of EPS. Not only EPS, but we're talking EPS is, under EPS is your tardive dyskinesia, okay? So I do have a question to everyone though. What are examples of drugs that we give to minimize extrapyramidal signs and symptoms in patients taking antipsychotics? So what are the drugs that we're giving to minimize the side effect of or the extrapyramidal side effects, when patients are taking antipsychotics? So what are those drugs? Okay, so if you're going to be asked in the NCLEX, we're actually giving anticholinergic drugs. We're giving your benztropine mesylate or your cogentine. You have bipyridine aciniton also. And then also you have your trihexyphenidyl hydrochloride or Artane. Okay, the brand name is Artane. But your benztropine mesylate cogentine is a very common medication. Okay, anticholinergic drugs to reduce the extrapyramidal symptoms. Okay, all right. So thank you very much for that, everyone, and also for the rationale they have put. So let's have the second question, everybody. Okay, so number 2 question, everyone. The triage nurse working in the suicide and crisis hotline receives the following calls from 4 clients. Which client statement indicates the highest risk for suicide? A, I hoarded sleeping pills so I can take them tonight. B, I am thinking of buying a gun so I can finish it all. C, I need to talk to someone about my depression. Or letter D, my recent divorce has been so overwhelming. Okay, put your answers, everybody. Okay, so I'm going to read the question again. The triage nurse working in the suicide and crisis hotline receives the following calls from 4 clients. Which client statement indicates the highest risk for suicide? A, I hoarded sleeping pills so I can take them tonight. Letter B, I am thinking of buying a gun so I can finish it all. C, I need to talk to someone about my depression. Or D, my recent divorce has been so overwhelming. Okay, so which one do you think will be the highest risk for suicide? Okay, so some of you are answering okay, A, B, C, or D. So who do you think is the highest risk for suicide here, everybody? Okay, all right. So let's see, what do you think is the answer? Now, why do you think is it A? Why do you think is it B? Why is it letter C? Or why is it letter D, everybody? Okay. All right, so justify your answer, everybody. So the answer to this question will be, all right, will be, let's see, everybody. Okay, so the answer will be, okay, let's have the answer. Okay, so for this question, let's have, okay, that would be letter A, everyone. Now, why is letter A the answer here? Because you're doing triage, right? Now, letter A is a danger. You know why? Because it's very important, number one, to ask a patient if there is a plan for suicide. A plan for suicide is very important. And both A and B has the plan for suicide. Both of them has the plan. And then you have to think which one is more lethal. So what's lethal here will be a gun is more lethal, definitely. Sleeping pills also will be lethal as well. However, after you ask for the plan, the next question is that you need to find out who has the access, or the availability of the plan. So the reason is going to be letter A because of the word I hoarded sleeping pills. So meaning that this person already has the pills ready to go and ready to take. Okay, especially when say so I can take them tonight. So especially if it says there that so I can take them now or I can take them tonight, or if there's a little time left, so definitely that person already has the access, and that's why that's the answer. Okay, so if letter A only says I am thinking of taking sleeping pills or I will take sleeping pills, then that is only a plan. We don't know yet if the patient has the pills or not. So you see, in the NCLEX usually, probably the answer could be B if both are just plans, because B is a gun and it's more lethal. But then you have to think that letter A, the person already has the access. Okay, I hoarded sleeping pills so I can take them tonight. Okay, all right. Now, your letter B may be the next best answer, because that's a lethal means of committing suicide. Your letter C, I need to talk to someone about my depression. Actually, that would be on the lower risk. You know, a person is able to verbalize and asking for help to verbalize also the psychological problem could be a lower risk. The fact that this person is seeking out help and able to verbalize. Okay. Letter D, my recent divorce has been so overwhelming. That's also, there's a possible risk as well, because that's a crisis, you know, but then we don't really see a plan yet or what's going to happen with letter C or D. Although all of these 4 are priorities, but then still, who do you think needs immediate assessment or immediate intervention? So especially someone who has the sleeping pills already. Now, someone who's saying, I'm thinking of buying a gun, then the next question will be, how will you do it? Where will you buy the gun? So you have to figure that out. What if the patient says, I don't have the money actually? So you see, it's very important to ask further, who will be really at risk for committing suicide here, especially when it comes to having the plan and also having the access. There are many signs of suicide, everyone. There are many possible clues, but then one thing that I would like to tell you also, um, it's also okay, to directly ask any patient, to ask them, have you thought of harming yourself? Okay, so sometimes it seems like maybe it's intrusive, but then for patients, for us to ask them, that is a direct question, and that's okay. Now, what are the signs or clues for possible suicide? So we have um, giving away personal or prized possessions, also changing living will or insurance policy. We also have someone, definitely usually in the NCLEX, someone who suddenly becomes cheerful, or a change in the mood or improvement in the mood, okay? Especially of a patient who has major depression, okay? The other signs of possible suicide also will be the client statements, especially statements like focusing on lethal objects. Patient who's saying, how does it feel to have a gun in your head? So those are client statements. And actually, when patients tell someone about their plan to commit suicide, it's actually a cry for help, okay? A cry for help. And that's why we have hotlines, because for that reason. Because unconsciously, these patients also wants to be stopped, okay, from harming themselves, okay? So hopefully, guys, you learn something from that, because usually you have these kinds of questions in the NCLEX, especially triaging patients, okay, psychiatric patients. Very good. All right, so let's have now your delegation question, everybody. So are you ready for the next question, guys? So, but before that, can you let me know from which state are you coming from, everyone? What is your state, everybody? From which state or country are you coming from, guys? Okay, so we have to welcome Aurora F. Gerard. Thank you for coming over here. Hi, Aida. How are you doing? Saidia Saman, Maria Mendiola, Ayadi Deli, Jen Tebisi, Ngozi Awuze, our student in the online academy right now. I got your comment for today. I'm going to respond later on in Ngozi. Chinyeri Ogochukwu, and also we have Nel Roma, Efinania, Abi Amos, so a lot of people, okay? And where are you coming from, guys? We have Cadiato is from New Jersey, Maria Mendiola is from Florida, okay? So I'm gonna give more shout out later on, okay? So right now, let's have your delegation questions, everyone. All right, so this is a long question, everybody, okay? So the registered nurse or RN, licensed practical nurse, LPN, and unlicensed assisted personnel or UAP care for a client admitted for major depression. Which task or task can be delegated to the LPN? Select all that apply. A, bathe the client. B, assist the client during meals. C, check the mouth after giving the medications. D, explain the admission process to the client. E, document the amount of food intake during meals. F, evaluate risk for suicide. Or G, complete the depression rating scale form. All right. So I will read the question again. The registered nurse or RN, licensed practical nurse, LPN, and unlicensed assisted personnel or UAP care for a client admitted for major depression. Which task or task can be delegated to the LPN? Select all that apply. A, bathe the client. B, assist the client during meals. C, check the mouth after giving medications. D, explain the admission process to the client. E, document the amount of food intake during meals. F, evaluate risk for suicide. Or G, complete the depression rating scale form. Okay, we would like to give a shout out to Alfred from the Philippines. Halimat Alimi is from New York. Saida Saman is from Minnesota. Yushika Singh is from India. Akudo Ekiago is from Maryland. Okay. All right. So we also have Menchi. Hi, Menchi. How are you doing from Singapore? Okay. MJ. Hi, MJ. I was talking to you last night. Thank you very much for your message. Okay. All right. So what do you think is the answer? A, B, C, D, E, F, G. All right. Which one can you delegate? Okay. To the LPN. To the LPN. Right. So let's see. Okay. So let's see your answers, everybody. Okay. So what will be the responsibilities or task that is okay to share with the LPN or to delegate to the LPN, sorry. Okay. The task that you can delegate to the LPN for a patient with major depression. Okay. Remember that your UAP could be a certified nursing assistant or a nursing assistant. Okay. So you have a nursing assistant here, you have the LPN here, and you have the RN also here. So let's see who gets the right answer, everyone. Okay. So let's get the right answer, everybody. Okay. So I will tell you one thing, everyone. Okay. In the NCLEX, when you have a select all that apply question, the rules that we have include, okay, the following. It's either there's only one answer or everything could be correct. Okay. And for this question, I will tell you there's only one correct answer, everyone. Okay. So you have a lot of options. In the next generation NCLEX, you'll be having a lot of options. So the answer to this question is letter C. Check them out after giving your oral medications or your medications. Okay. Now, congratulations to Melissa Loretta, Ayadi Deli. We have MJ Enriquez, Aurora F. Gerard. Okay, so we have also Janine Lubaton. Very good. So we have Menchi. You got the right answer. Okay, we also have Maria Mendiola. You got the right answer as well. So congratulations. Your letter A. Okay. So let's explain. Letter A, bathing the client or bathe the client is definitely your UAP or nursing assistant. Your letter B, assist the client during meals, especially feeding, that would be your nursing assistant because this patient is having major depression. You also have your letter D, explain the admission process. That's for the RN. Explaining, teaching, discussing, that would be your letter RN. Your letter E, document the amount of food intake during meals. Some of you put letter E, but actually letter E, especially the percentage, the one who documents that and observes that, of course, is going to be the UAP. She's the one or he's the one feeding the patient. So that's going to be part of the documentation of the UAP, how many percent was eaten by the patient. Almost the same way when you have the UAP observing how many times the patient went to the bathroom, or how many, if the patient is continent or incontinent, so that would be something that we can delegate to the UAP. Okay. Letter F, evaluate risk for suicide, and that would be the RN. Okay, that's evaluation. And then letter G, complete the depression rating scale form. That's an assessment of the degree of suicide or depression risk or depression. Okay, the risk, the degree of depression. So letter G is an assessment. So that would be for the RN, definitely, especially that the question here says for a client admitted for major depression. Admitted. Okay, so the answer is going to be letter C only for this one. So again, remember A, B, letter E, those would be for the UAP or nursing assistant. Your letter D, your letter F, and G, that would be for the RN, everyone. So hopefully that was a clear explanation for everybody. And take note, while you're listening to our Facebook Live, you can start writing down also, the examples of tasks for the UAP and for the RN also. Okay, so that's it. And we always go back to our memory trick, our acronym. We're in RNs do not delegate EAT: evaluation, assessment, and teaching, especially admission assessment or comprehensive assessment. Okay, including planning. Care planning is always the RN, of course, developing the care plan. Okay, so very good. Now, so let's see. So that's the answer, everybody. Okay, all right. So keep on making comments, and later on I'll go back there and make comments as well if you have any questions. Okay, so there was UAP in the question. Okay, so that's why you assign the documenting the food intake to the UAP, everyone. Okay, so let's proceed, everybody, to the next one. So we have number 4. Okay, so number 4 question. All right, so this is going to be assignment and delegation. Okay, so number 4, a newly licensed nurse works under the supervision of an experienced registered nurse in the psychiatric unit. Which client will be most appropriate to assign to the new nurse? Okay, which client will be most appropriate to assign to the new nurse? So this is a newly licensed nurse, okay, in the psych unit. A, the 34-year-old client with bipolar disorder who is in acute manic state. B, the 45-year-old client who has command hallucinations due to relapse of schizophrenia. C, the 62-year-old client who shows tremors and anxiety due to alcohol withdrawal. Or letter D, the 46-year-old client with anorexia nervosa who needs intravenous fluid administration. Okay? A newly licensed nurse works under the supervision of an experienced registered nurse in the psychiatric unit. Which client will be most appropriate to assign to the new nurse? Okay, A, the 34-year-old client with bipolar disorder who is in acute manic state. B, the 45-year-old client who has command hallucinations due to relapse of schizophrenia. Letter C, the 62-year-old client who shows tremors and anxiety due to alcohol withdrawal. Or letter D, the 46-year-old client with anorexia nervosa who needs intravenous fluid administration. Okay? All right. Okay, so you can put your answer, everyone. All right. So in this situation, what will be the best answer? So some people are still putting their answers, and you're putting your rational also, everyone, and that's really very good. You get these kinds of questions in the NCLEX also, wherein you have a new nurse, so what kind of patients are you going to give to a new licensed nurse, especially if it's an RN also. Okay, so seems like an easy question, I guess. Okay. All right, so let's have the answer for this question, everyone, without further ado. Okay, hopefully this will come out in your NCLEX. Okay, all right, so the answer is going to be letter D. So the answer to this question is going to be letter D, everyone. The 46-year-old client with anorexia nervosa who needs intravenous fluid administration. Very good, because this is the most stable patient among the 3 or among the 4 psychiatric patients. Now, letter A, you cannot assign a newly licensed nurse there because that's acute manic state. Letter B, command hallucinations. That's a little bit dangerous as an unstable patient. Letter C, tremors and anxiety due to alcohol withdrawal. That's also an unstable patient. So the best answer here, everyone, is going to be your letter D, the 46-year-old client with anorexia nervosa who needs intravenous fluid administration, everyone. So very good, everybody. You got the correct answer. And your letter C also, you have to be careful because you can have delirium tremens in that situation. Okay. All right. So congratulations, everyone. Put your score, okay, in the chat box, everybody, and I'll make some comments later on. And later on, also, we'll put some additional information in the comment section, information about um, tardive dyskinesia, information about your different psychiatric medications. Okay, so we'll give you those information there so that you will understand further our explanation for tonight. So go back later on, and read the additional information and sources that we have. Okay. Okay. So before we end for tonight, everyone, okay, I would just like to give a shout out or plug our services. So we have the Matus Nursing Review and Matus Nursing Review Online NCLEX Academy. So students can have access online and also do a self-study review with our workbook. Anybody who likes the workbook, please give a shout out in the comment section also. So we have a 400-page workbook, especially for students who graduated many years ago or new graduates who wants to have an interactive, simple, fast, and easy NCLEX review. I do have my book also in Amazon, and at the same time, you can see the online access there. You can always watch the videos as many as you want, and also we have our Facebook groups as well. So tons of resources available for you, but I guess the benefit of the program really is that we don't have only a Q bank. We have quizzes, of course, quizzes after each videos. But then again, it makes your NCLEX review very easy because you know why? You're listening to me while I'm giving you the explanations, and the curriculum is arranged in such a way that it's very organized to everybody, from fundamentals of nursing up to psychiatric nursing, okay, until your final predictive examination. Plus, all of the videos that we have in YouTube or Prioritization Delegation without any commercials is in the online academy. So you can watch all of it there because we're recording all of this, everyone, and putting in the online NCLEX Academy. Okay? And of course, lastly, I always tell students to think positive. Very, very important, everyone. So you can go to our website as well at Matus Nursing Review Online NCLEX Academy, okay, .com, and you can get this very nice bottle that I have, gym bottle, okay? So very nice, everybody. So think positive and always think that you can always do it, okay? So NCLEX is just around the corner. It's within your hands, so keep on studying. And I always said, always find the right resource for your NCLEX review. It's really finding the right resource, the resource that fits your needs. That's the number one secret for passing the NCLEX, aside from your motivation, is to find the right resource that is easier for you to understand. Okay? And then for last week, okay, so our winner last week was Kehende Adetunjie Gibayay Semori. Okay, so our winner, so please congratulate her, our free 90-day online NCLEX review. Okay, and thank you very much, Olayinka, also for giving a very good shout out regarding our workbook. So thank you very much. So thank you very much, everybody. I'll go back to the comment section, and I'm gonna have to give you some additional information there. I'm gonna give comments. So make comments there. I'm gonna put some hearts or likes there, everyone. But again, so next week I will see you again, everybody, and you all take care, be safe, and get your vaccinations if possible. Okay, and again, thank you very much, everybody. So okay, good night.